All right. I'd like to welcome everyone tonight. And thank you so much for taking time out of your evening. My name is Dave Carbier. I'm with Exocad America, and I'm really honored to introduce our featured speaker of the evening, and that's Dr. Diana Tadrus. Many of you know her. I've seen the sources for the registration, so I see that she has many followers on Instagram. Dr. Tadros was a graduate of the University of Tennessee and completed her residency at the University of Florida in 2012. In 2020, it was a great year for Dr. Tadros. She was voted best dentist in Fort Lauderdale, as well as listed in the 40 under 40 list from Benko. She's a graduate of COIS and an accreditation candidate, the only accreditation candidate from Fort Lauderdale for the Academy of Cosmetic Dentistry. So without further ado, I'd like to ask Dr. Tadros to join us.
Hey guys, this feels weird. I'm not talking, nobody's talking back to me, but thank you guys for being here tonight. I think you're in for a treat. I am not a videographer. I will preface this whole presentation by that, so don't judge me on that. But a lot of you did ask about different ways to get involved in Exocad, and I think it was important to kind of do a cohesive lecture and presentation to present to everyone at the same time, so we can kind of hopefully answer a lot of questions that everyone has as far as Exocad. As far as myself goes, to kind of tail off of what Dave said, I practice in Fort Lauderdale. I bought a practice here 2.5 years ago from a phenomenal dentist who is still alongside with me. Previous to that, I was in Manhattan for about 6 years. So I'm really honored to be able to talk about this because you'll see this whole venture happen very fast for me in our practice. Prior to my ownership, we weren't using digital charts. We were using kind of digital scheduling. So we've really taken the practice kind of in this whole crazy stratosphere. And with that, I really have to thank my staff because within the span of like 3 weeks, I brought on board like a scanner, a printer, an Exocad, and God bless them because they really are been a huge backbone to this whole ecosystem that we've created inside of our practice. So we're going to get going here. We're going to kind of dive into it. And feel free to ask questions. You can be as honest as you want, and I will be in return. So we're going to get going here and let's get started. So the first question I got a lot was, why did I choose Exocad? Or even just in general, why did we go through digital dentistry? And for me, there's quite a few things that came into play as to why I chose Exocad specifically. The main one for me was lab communication. When I got my first wax up that was actually a digital print and not a stone wax up, I was like, okay, wait a minute. The reason I wasn't doing my own wax ups to begin with is because I can't wax. So I called the lab. I said, what software are you using? They said Exocad. So I figured if I got the same software they got, we could speak the same language if I got stuck when we were designing or whatnot in the beginning. The next that kind of came into play for me was, I could design on my own time. I'm not waiting anymore for the ceramist or the lab to do the design. I'm not waiting for anybody. I can do this on my own schedule whenever I have a free time to do it. And increased patient acceptance. For me, we had a little bit of hiccups going from the consultation appointment to having a patient pay for a wax up and then having them come back to see if they wanted to even do that. Some patients don't want to put down $500,000 up front for just a wax up, So for me, now when we're doing everything chairside at the consultation appointment, the acceptance rate has really gone up, and not just from saying no to yes, but more so from saying, oh, I think I just want to do one to, oh no, I really think I'd rather do 8, So when they can see it and not just in a 2D picture, but sometimes in a 3D image, it really does help communicate it better to the patient. Reduced turnaround time, we kind of mentioned this, now you'll see here how we do it. I'm doing the wax ups now in about 10 minutes. And a lot of times I'm doing it chairside with the patient. So there's no longer that 3-week turnaround time. And with that goes decreased costs. Like we said, you're not paying somebody, you're not outsourcing this anymore. I'm doing this, you know, other than the initial cost that you're going to have to take on for any kind of design software, there is a decrease in cost, a huge one, and we'll discuss that too. And the last one, and not to be prude, but I really can't wax for nothing. You can ask Betsy Bateman. I was just at her wax up course this weekend. I ain't it when it comes to waxing on stone models. It's not happening for me. So I'm pretty good for the most part with computers, but with waxing, it was a really big challenge for me in dental school. And I proved to myself this past weekend, it's just as much of a challenge 10 years out of dental school. I kind of call this one Design in the Sky only because a little bit of a funny situation. A few times I have actually been designing on my way to a workshop or a CE. I do travel a lot. So it's really kind of crazy to be designing a mile high in the sky and actually even being able to send the STL file or the wax up to the printer from the sky so that my staff can take it off the printer while I'm not at work. So when I do it like this, I usually remote into my office computer because that's the one that's connected to my printer. But it is kind of a funky, you know, way to do this if you're someone who's always on the go. And with that brings this, you can run Exocad on multiple computers, and that's probably like most softwares. Your license, your dongle, the USB that you get, you can put that in multiple computers if you have a laptop at home, if you want to travel. So you've got the flexibility. It's not tied to one computer. I think a few people asked about that. This is an interesting one I got. A lot of people were saying, well, you know, I don't own my own practice yet, so I can't get Exocad. And I would actually beg to differ because it's your license. You own it. And if you work, let's say, from 2 different practices, you can have Exocad on your laptop. And as long as those practices have scanners, you can upload those STL files into your own software and design from home. And then should you ever own a practice or you leave that practice, that license follows you. It's on your laptop. And with that token, multiple doctors, if you're in a group practice, you can run under the same license. And there is a part which I'll show you where you can actually organize by your provider so you can organize your cases in the software. So let's kind of talk about the in-house digital workflow. Dave mentioned in the poll that quite a few of you guys already actually are you know, working with scanners. And my take on that is if you're already working with a scanner, you've already eaten the majority of the cost of this workflow. You're just missing the wheels at this point. So, you know, you go from the scanner, you're going to go to a design software, and then you're going to go to a 3D printer. That is the full cycle to do this all in-house. Some of you guys can actually do this with, you know, milling units as well. I don't have a mill yet, maybe one day, but for now, that's the workflow. And I kind of want to talk about cost because that's important and you need to know kind of what you're getting into. A scanner, it's a huge range. I made up a number, to be honest. I needed a number for this slide and that's what I got. This is not a scanning lecture. This is not a CAD CAM lecture by any means. I have the iTero 5D. I got that back in August. I like that. I haven't had any troubles with it. Design software, you know, I have a lot of colleagues who are using Blue Sky Bio or maybe they're using 3Shape and Implant. Design softwares are great. For me, I just wanted the software that my ceramists were using. I didn't really want to go outside of their ecosystem. I did try Blue Sky Bio. I just felt like it's very elementary compared to what I was trying to do, especially when I'm trying to totally eliminate the wax up portion to send to my ceramist. So Exocad varies depending on what you're actually going to try to do with it. There are some super dentists who want to design everything. They're going from their dentures, they're going to the implants, all that jazz, bite guards, everything. There's some that are like, I just want this to just do basic wax ups. Basic wax ups, you're about 2,000. My package, I ended up switching my license over to the Galway version, which will let me have the virtual articulator. And then I've got more tooth libraries to work with, which you guys will see. So there's a little bit more flexibility in the designing when you have the full spectrum software. And then 3D printer, again, made up number, don't quote me on it. Actually, and I'm a liar because I actually got 2 printers for less than 3K. My first 2 printers were actually the Sprint Ray Moon Ray printers. They have now been discontinued. They were about $2,000 each. That was my entry-level printer. It was a good printer. I just started to need something faster. The two other printers I have are both pros. One's a 95 from SprintRay and one's a 55. They both are at $6,750. That's the price point for both. And it really depends on what you're trying to do. If you're going to be printing more cast surgical guides, you're going to probably go with the 95. It's a bigger platform. It's a faster print. If you want to print more temporaries, definitive crowns, anything that requires really high accuracy, then that would probably be the Pro 55. And then I know there's Formlabs on here too. I'm not too familiar with it. I found some kind of rinky-dinky video on SprintRay that I'll show you guys later that kind of compares the print speeds. But other than that, I don't have much experience with Formlabs. So I kind of want to talk about this here. I touched on it a little bit on how my workflow looked like before I had Exocad. So before I had Exocad, you know, the patient was coming in for the consultation appointment. In my practice, you know, we only had a scanner for a short amount of time before I got Exocad. So prior to that, I was taking impressions and I was sending it to the lab. Then the patient was deciding, okay, yes, let's move forward with the wax up. Great. I'm waiting about 2 to 3 weeks and we're looking about $250 to $1,000 per case. I'm going to be honest, I've never made money on a wax up prior to Exocad. I probably lost money because I would always tell patients, you know, we'll credit it toward the treatment, or I never was upcharging it. It was always just whatever that flat fee was, just to kind of get the case going. I do now the wax up chair side at the consultation appointment. So they're not coming back for that. It takes me about 30 minutes from the time they sit down and they scan to the time we kind of come up with a definitive restorations of what we want. And I actually don't charge my patients for this because I just feel like, you know, it's the right thing to do. It doesn't take me much time anymore, chairside, and I think they really appreciate it. And again, the acceptance rate, we're not having an issue with the acceptance rate anymore. So that is kind of where we're at. Now, many of you guys have a really awesome new patient intake process already. Some of you guys have your assistants taking photos and the scan on every new patient. Some have hygienists that are doing it at the beginning of the appointment. And I encourage you, if you already have that kind of workflow, with the existing patients you have, if you already have a scan and you have photos, and there's a patient that, you know, has always kind of tethered on maybe doing, you know, something cosmetic, next time they come in, show them, you know, a mock-up or a wax-up on Exocad, or better, you can email it to them. You can actually email them the web view. You know, so I actually went back and I did that with a few patients that never actually got the treatments in 2019. And we actually got some of them back when I showed them visually what it would look like. So kind of, not to derail, but just a tidbit there. So if the patient said, you know what, let's move forward. I love the wax up, you know, I want to go ahead and move forward. Well, prior to Exocad, you know, they were coming back again because for prep day, you know, wasn't happening at that time. I was just bringing them in to see if they actually wanted to do it like this. Did they like the wax up? Were they ready? That kind of thing. That usually then the time frame, we could get them back maybe 1 to 2 weeks later, depending on the schedule. So there was a little bit of a lag again. If the patient now tells me that they want to move forward with the wax up when we're at the consultation appointment, I'm moving it to the printer. And the cost for me to go from, you know, that appointment to the prep day for my temporization is about $2 to $4, and I'm going to explain that. It's going to be $2 for my resin if I'm printing a cast. If I'm going to make my own stint off the cast and then do it maybe with Luxatemp. It's going to be about $4 if I'm printing a long span shell temp with the new crown resin that SprintRay is selling. That's the Bago Varcio resin. It's excellent. It really does polish nicely. If you're looking for a cheaper one, there's one by Dentka that is like this much bigger of a bottle, and it's like half the price. And in it for temps, it also polishes really nice. So that was my workflow prior to. This is my workflow now. And we're actually going to do a little chairside one, how we do it in our office. You'll see that a little bit later on. So the timeline for me, because it was a little bit hectic, went like this. Beginning of August, my iTero 5D arrives. By August 15th, I got the Exocad software in the mail. And by the 26th, I had my first SprintRay printer. And I'm thinking, great, I'm ready to roll. We did our training. My staff is ready to turn to drinking to solve their problems, but we were ready to go. Well, not so fast, because when I got my Exocad software, nobody could install it for me. And this is just a cautionary tale. When you go in to dive into digital dentistry, make sure that the reseller that you are buying these softwares from knows how to install it and knows how to train you. This is not a direct-to-consumer product, so you can't just call up Exocad and say, hey, what's up? Like, come get this on my computer. That's not going to happen. So it took me quite some time to get somebody to install it. I ended up having to transfer my license to the company I'm with now, who is like bomb awesome. And I couldn't say better things about them. So they really got me back on track because I was feeling a little bit deflated. October 5th is my first Exocad training with the company. Less than 10 days later, I realized I needed a second printer. That's how quick it started to really take off. And not to say that the Moonray was a bad printer, but you have to realize on every printer, you can only run one type of resin at a time. So if you want to print a temporary, but you also want to print a cast, you can't do that. You're going to have to pick one, wait the hour and a half, print the, so, and for me, I'm the only one doing it at my practice. I needed something where I could run dual printers at the same time on the free time that I did have. So beginning in December, I realized I needed something a little bit quicker, a little bit faster to add on to our printer nursery that we have at our office. So I ended up getting the Pro 95. And that was, huge for me. That's actually been my primary printer. The thing I do want to say about this is I really am doing this kind of on my own. So if you guys have a staff that is really tech savvy or they already know how to use the software, you're already ahead of me. If you have a scanner, you're already ahead of me. Me and my staff, we all learned this together, and it's been, great, but I don't want to put it on them. This is above and beyond for me, they already do enough. So this is kind of something I'm doing on my own, and we're a small practice. I mean, we have more printers than we have staff members at our office. So, if I can do this, you can do this. It's really not that hard. And then in 2021, right in the beginning, we got the fourth printer, which is the Pro 55, when I started getting more into printing temporaries. All right, so what are we doing and what can we do as cosmetic dentists when we're working within Exocad? And this is not even touching the surface, but this is all I can handle right now. So diagnostic wax-ups, we've already kind of went over that a few times, but they are kind of the bread and butter of what's driving everything else in the practice. And then injectable direct composite. I honestly think this is something that's unique to digital designing. I don't know how you would do this on a traditional cast. It must be very complex, but in digital designing, it's actually very, very seamless. And we'll show you a case later. Shell temporaries. You can decide to print the cast and make a stent for a patient, or you can have the temporaries ready to go by the time they come in for the prep appointment. This works pretty well if you're doing, long span and they might be in it for some time. You've got a stronger print. Some of the materials are actually considered definitive, although that's a stretch, but they're they're sturdy. And then also same day temporaries. And this has actually kind of saved my bum a few times, because if you can give a patient a few copies of their temporaries and they're going out of town or they're traveling, they've got backups and they're not paying another dentist to make something from scratch or anything like that. So it won't change your print time if you add more of the same. If you just, copy, just like copy paste on a print platform, you can print 4, backup temps. I usually even keep 1 backup just in case, who knows, maybe if something happens to the definitive crown, we have the shape. So there's a lot of options there. And something that's I dived into that actually kind of worked out pretty well is making a Maryland bridge / implant provisional. And I'm going to explain this in a weird way. So I'm doing implant designing and I'm placing the implant surgically, and I want to know, where is my crown going to be in relation to the implant? And I want to have an implant crown, a provisional, ready to go the day that I'm placing the implant. So what I've started to do is I put little wings on the lingual, and I'm sure I'm not the first, but I didn't know other people were doing it. I'm behind, I just got a scanner, but I put wings on that temporary. And the reason why is if I don't decide to load the implant that day for whatever reason, if I'm not really confident on, the stability of the implant, then I'll actually fill the access hole that I was planning to make a temporary abutment through with resin, and I'll actually bond the wings onto the adjacent teeth. Now, I don't generally like two-winged bridges, so sometimes what I'll do is I'll just put two, and I'll see which one seems to be better with the occlusion, and then I'll cut one off. But that's worked out pretty well for some cases I've had in the provisional phase. Okay, so we are going to get into pay attention here, because this is where it gets meaty, nitty and gritty. Okay, the 10-minute diagnostic wax up. So there is what I would say comparable to other design companies, a smile design module in Exocad that is geared toward dentists, because your labs are not smile designing next to you. This is really something that is very basic. All you need is a full face photo and a scan of both the arches. When you get to Exocad, you'll upload both. Now, for those of you that have scanners, and for those of you who have printers even, Exocad integrates with those. So you can actually, from your scanner, click the selection to chairside milling and send it straight into Exocad. So you don't actually have to go through your iTero website or your scanner's website to download the STL. It'll actually integrate right in, and then you can go from there. And then all you have to do is upload the photo. I'm going to show you a quick video of how we do it at our practice. Do not try and learn all the steps of it in that video. We sped it up because I don't think you want to sit there and watch me design it for 5 minutes twice over. So it's sped up. We're going to go through the same case at a slower pace right after this video. Hey guys, we're going to show you guys how we do the 10-minute Exocad chairside wax up, so follow along. Okay, so we have our scan and we have our full face photo that we have gotten from our assistant. So now we're going to come to the computer and we're going to do a quick mock-up design before we show it in the laboratory. Okay, at this point we have just a mock-up of before and after. This patient wasn't sure if she wants to do 2 veneers or if she wants to do 4. We went ahead and did 4. We're going to show her both in the operatory. All right, let's get to it.
This is what we were looking at when we did 4. So we evened out everything with the 4. If you were to only do 2, it would look something like this. So you could maybe go either way. 4 would be a little bit more uniform, but it seemed like to me you could go either way.
I think I really want 4. Okay. Looks much better 4.
Great.
So if the patient decides they're going to move forward with treatment, generally the next step is I'm going to go into Exocad. We're going to clean up the scan just a little bit and the veneer preps. We'll just make sure the occlusion is okay. And then we are going to take it to the printing room here. So all my printers we have here, and we've got takes about a 30-minute print if we're going to do a cast, or about 18-minute print if we're going to print shell tips. And that's a wrap. Okay, so that case was pretty interesting. That actually was a simulation that my staff did, and we're actually going to do that case. I'm going to go through it, and we're going to walk through step by step. Don't really try to learn every little thing you can. I just want you kind of see kind of an overview of how it's done and kind of get familiar with, all the buttons and options. So let's go through it together here. Okay, so the first thing, this is kind of, I'm going to pause too at some spots just so we can kind of talk about this, but this is Exocad's kind of, main menu, main screen. On the left side, you can pick your client, which as a dentist, it's going to be different providers. If you have 2 dentists working in the office, you can actually categorize it by that. And then you're just the name of the patient, and then you can actually save this whole project. You can also send this project to your ceramist. And this is also another very important screen. This is your main menu with Exocad. It's got everything you're going to need to design. Now, as a cosmetic dentist or anyone who's kind of toying with the realm that I am, you're probably going to stay on the top half of the screen. The bottom half is like for real badass super dentists that know how to do all these bar segments, bar pillars, you know, that's like at the Stanley Institute. That's not my thing. So everything that you kind of need for wax ups, shell temps is going to be at the top half of the screen. And the software is very smart because in the middle is the material. So whether you're going to be milling or you're going to be printing, it knows kind of the parameters of what you would want as far as thickness, and you can always change that, but it knows already the settings for whatever you're going to be using that for. So here we're actually going to just do the wax up. I generally will pick either mock-up, anatomic pontic, or anatomic wax up for this. And this is for 3D print. Again, I don't have a milling unit. So I kind of leave all the settings as is. I mean, if it's good enough for them, it's good enough for me. I don't know. So everything seems pretty standard. So you can actually copy and paste. I will advise this. If you have a patient who doesn't know how many teeth they want, add the max that you think that you want them to have, and then take away in the design process. It's much harder to go back and try to add teeth. Another thing here to note is you always should tag an antagonist tooth in there so that it'll ask for the opposing arch. Otherwise, you're just going to do it without the opposing arch, which might be fine. This is me loading the scans in because I did not do this one directly to chairside milling. And you're just going to orient the scan so it's occlusal side up. That just helps with orientation. You're going to upload the full face photo. And you're going to pick 2 points on the scan, 2 points on the face photo, and it is going to auto align those 2. This doesn't have to be an exact science. This is kind of just for reference for the patient at first, and then later on you can kind of go tweak it if you're using it, you know, really to facially drive this treatment plan. And then it'll let you tweak it because it's always a little bit off, so you can tweak it just a little bit. Again, this is just kind of more so for a little bit of reference. It's going to auto detect the lip, but you can, if they have irregularities in their shape, you'll go back in and you can kind of, you know, adjust it. She has a little bit of a uneven curve at the bottom lip there. So that's what we're doing here. And I actually slowed this down just to kind of be able to give myself time to talk it through. But once you do it, you'll do this pretty quick. And it is going to auto detect the eyes. So you just want to adjust that a little bit. This is going to help start to facially orient the scan into the face. Okay, spend time here. This is going to be, if you can spend the time to get these lines properly, you will be ahead when it gets to the next step. And this is something I learned the hard way because, to be honest, the first 3 months, I didn't even know what the lines were. I thought it was an arbitrary midline, proportions, great, looks good, got to go by. No, spend time here. I'm going to go through it. The light blue line, that line that goes horizontally is actually the incisal edge. So for COIS, all my COIS tribe, if you already have where you want your reference point for step 1, or you have the repose photo, you can actually upload the repose photo into Exocad as a secondary photo, or you can you know, superimpose it on top of the smile photo so you actually know where cuspid 0 is. But if not, you can do it the old-fashioned traditional way, and you can say, I like this tooth as my reference point. So you're going to put that horizontal line right at that reference point. Then you're going to play with the midline. She has, you know, as you can see, a big width discrepancy between the 2 front teeth. So we're trying to make this, you know, as symmetrical as we can and kind of play with the dimensions. The lines that go like this are your golden proportions, and you can actually change the proportion guide. If you're not a golden proportions fan, you don't believe in it, did you wrong, you can change it. You can freestyle it later, or you can change it on the left menu there. If there's other helper lines you use, I could probably guarantee Exocad has it in that menu on the left. So we're going to kind of work through that there. The dark blue line is your smile curve. You know, depending on how, you know, steep you want how long do you want the centrals compared to where that goes back, that's another thing you can orient. This can all be fixed later. It can all be adjusted later. I just like now, I spend a little bit more time here so I don't have to play or fidget with it as much in front of the patient. So that's us here. We're working on the proportions, or about as what I think could be about right. This patient actually ended up going with 4 veneers. Truthfully, I think she could have done 2 or 4, but she wanted 4 just to kind of even out the spacing a little bit more. So, well, now that I'm looking at it, maybe she should have done 4. I don't know. So, all right. So now we're in this menu here, and this is kind of the fun one. This is, I'm going to tell you right now, I'm going to pause it again. This is this menu. This is the screen patients love. This, we always think they love the before and after, and they're like, wow. No, with Exocad, this is the screen that we get stuck at. They love seeing their face on one side and their scan on the other, and how that is going to orient. And this is also the best time to start talking to them about how much teeth you have to reduce based off where you're going to align the teeth. And this has actually ended up turned into a lot of Invisalign cases for me prior to prepping. Because if you have a patient that comes in and says, I want no prep veneers, and you're going to align them that put the teeth where you want them, and they see all that show through on the scan of their natural teeth, they start to think a little bit differently. Another caveat I have, if you have a patient who thinks they want composite veneers and you spend an hour in this screen with them because they are nitpicking, and then they say, this is the exact shape I want, move it to porcelain. Unless you're Marshall Hanson and you can replicate that to the T, move it to porcelain or do the injection composite technique, because it is very, very tricky when you're stuck in this screen. The longer I'm in this screen, the higher I charge for my composites. So that's kind of my rule of thumb. But no, I will tell you, you will do yourself a great service if you can share this screen with your patients in the operatory and kind of go through the 2D and the 3D realm with them. They really like this. So here I'm going to kind of let this video play a little bit more. I just kind of got sidetracked there. You can pick tooth shapes, you know, everyone's different, all teeth are different. Patients like this too. They get to say, you know, oh no, I want it more like this, I want it more like this. So there's about over 200 libraries. You're never going to get there unless you're just trying to get there, but there's a few that I kind of stick to as far as shapes go. You can start orienting the teeth kind of roughly how you want. I don't pay too much attention to this if I'm going to be chairside with the patient. For me, it's just kind of a rough draft to show them how we're doing it. It's also a good time for them to see the gingival margin discrepancies on the front teeth. They tend to see it more when it's all one uniform color. And we're actually going to show you how you do a virtual, you know, crown lengthening to prepare for the case. So this is kind of, you know, just a rough draft for them. After you kind of get the teeth where you like it, you can actually set it, and you'll actually see soon here that we're going to have a before and after. Right now, I'm just kind of toggling the teeth, rotating them a little bit. Don't judge me on this. This was just for LOL fun here. And then we get to this screen. So this screen, you can actually share the screenshot or the screen or the web view to patients. So if you didn't have time to do this chairside, no big deal. Do it, you know, during lunch, do it maybe the next day, and you can email this to them. So, you know, they can look at this virtually. They can even toggle off their teeth, like I'm doing here on the upper left, between 2 teeth, 4 teeth, 6 teeth, 8 teeth, so they can get an idea of what it would look like. So that's kind of, it's been a really neat, you know, interactive thing for patients to do. I usually send them a link to this anyways after I've met with them on it, just because they love to see it. So we're here. The software assumes that you've got the teeth for the most part where you want it. Now it's just kind of final placements. The nice thing is you can still put the face over it and take it off. If you're face scanning, you can bring the face scan in as well. I haven't found face scanning to be too tremendous of a benefit over face photos if you have a good face photo with the orientation of the glasses. So generally face scanning is more so if I've got like a huge weird cant or inclination, then I'll try to bring this scan in. And so here we're just kind of cleaning it up. The one thing I want to mention in the mock-up category for Exocad, it's going to tell you how much clearance you have on the facial of a tooth or how thin it is. And I was just, you know, talking to Rigo Nelson in Seattle. And I was saying, iTero tells us, occlusal clearance when we are prepping teeth. I wish I could just scan my wax up into iTero, and then when I scan my prep, it'll tell me on the facial if I have enough reduction for veneers or whatever I may be doing. And maybe that's out there and I don't know about it, but with my iTero, from what I know, I can't do that quite yet. But this will do it before the appointment, so you actually already know where you're going to have show through and where it's going to be pretty thin if you leave it as is. And that's important too if you're going to be making temporaries, because your temporaries can't have natural tooth structure poking through them. So I'm just cleaning up the lingual here because the software assumes everything's a crown until proven otherwise. So you're going to clean off all that lingual unless you're maybe doing a crown. And you see here on the facial is where you've got that pink is where it's getting really, really thin. So this is not really what my wax ups look like with the teeth sticking out. This was just me trying to show you guys how you do a digital crown lengthening. And all you do is you go back to the scan data and you just remove the gingival margin just like that. It's not an exact science until you take it to the mouth, but at least it puts the teeth in relative position of where you want. You can kind of keep playing with that until you kind of get it where you want. So it's pretty simple. It's just this one little swooping motion around the gum lines. And I don't do that in front of the patient because that's just another step, but it is kind of something that when they come back, we look at it together digitally and we can toggle back and forth so they have an idea of how much we're removing visually. Okay, sorry, I think we are. Okay, that video, we don't want to watch that one again. I'm over it. So this is lab communication, and this has actually been a huge positive for me. My ceramist is a beast. I have MJ as my ceramist, and this is the time I really have to like bow down to her greatness. She has been a dream to work with on these cases. She, her and I have a great relationship through working with these, me designing it, her getting it, and it's really been a nice synergy. And I'm going to show you how amazingly she will replicate exactly what I'm doing, chairside and digitally. So this is a case she did for me. This was actually my accreditation case that I submitted last year, and it was a beautiful outcome. So that was one of the ones she did. And that was my first Exocad design I did with a ceramist. So, okay, so this patient presents to us. She wants to get veneers. She's, doesn't like her teeth, and we're going to kind of work through how do we get to the point where the lab is bringing me back the ceramics of what I want. So this is kind of the workflow now with my ceramist. This is the patient's initial presentation. I'm going to design the wax up digitally. I'm going to do one of two things. I can send MJ the whole Exocad project that already has the preps in it, that already has the wax up in it, and has the temps scanned as well, all merged into one STL. Or I could just send her an STL. If your lab isn't using Exocad, or you're not, they're using something else, you can still just save the STL and send them that. That works just fine. Even for labs that have Exocad, if you're sending them a wax up an STL file from somewhere else, they just put that into Exocad. It's no problem. So MJ gets my wax up. In the meantime, my patient gets shell temps. They look like this on the day of prep. We did a few gingivectomies, crown lengthening around some of the teeth. So the patient's sitting in this while MJ is working her magic. She brings me back. Now, don't mind these little STL files that I imported into my PowerPoint presentation. They squished them. My teeth do not all look short and stubby like this in the mouth, I promise. But it's just not doing a good job. It's not doing it justice. But I think these photos will. So that's where she ended up from the beginning point, and really beautiful job by MJ. So that was a case, patient left happy. That was actually a case where the patient thought she only wanted 2. And we designed 10. And when she saw 10, she said do 12. So, it really is kind of, sometimes they know they want an aesthetic outcome. They just don't really know what it's going to take to get there. Okay, what if we are doing direct composites? And I want to talk about this because this is a very special case. This patient she cannot stay in the chair for more than 45 minutes. She's not a highly aesthetic patient, but she has severe TMJ joint problems. She's been treated numerous times in the past. It took us 4 appointments to do a crown prep on that number 3 that you guys see in the back to replace that silver crown. It was 4 appointments to prep it because she just couldn't. So I felt like this was going to be a great opportunity because, again, she's not going for porcelain, she's not going for anything crazy, but she wanted an aesthetic result. So I said, you know, do you mind, Dory, if I do this as an injection composite technique? It's this new technique that I like to do digitally, and you won't be in the chair long, I promise. So she said, okay, we'll see about that. So this is kind of how we did it, and this is kind of how you'll do it too with any kind of design software. So this was her initial presentation. We did change out the silver fillings before we did the front 6, so this is a little bit older photo. But how we started it off was like this, and then basically what you'll do is you'll import the STL, just like we talked about with every other photo and with every other case. You're going to bring in the STL into Exocad. You're going to go ahead and design the 6, okay, as if you're doing the full case. And then you're going to save this STL as its own STL. And then you're just going to unclick every other tooth on Exocad. And then you're going to save that STL. By the time you get to the printer, you're going to print 2 types of cast, one that has all 6 teeth on it and one that has every other tooth. You'll use a clear PBS stent over both casts, and you will just poke holes in it where you're going to inject the composite, and I'll show you what that looks like. This is a rough photo, and I put this here because Instagram is a lie, okay? If I were to have to put this case on Instagram, I'm only going to show you the final, but you know, there is a learning curve to this technique. You know, the composite kind of goes everywhere. For me, it does. You know, there's a lot of polishing involved in, but at least you're getting the general shape done, you know, fairly quickly. You can also do this with your temporaries. If you want to do temporary veneers, you don't need to isolate every other tooth. Just take your full cast, wax up, make a clear stent, and inject those bad boys all the way around, and you'll have one long span Lux or injectable composite temporary. So that works out well, nice too, when you're doing temporaries for veneers. So this was it after every other tooth. Looks like this. Again, I'm going to zoom in on how crappy and rough it looks, just for you guys can judge me on that. And then this is it again after we kind of knocked off those little nubs, and I haven't done a final polish, but that's after we've done 6. We get to that point. Patient comes back. This was her initial. I have her come back the next day. She's tired. You know, it took a good hour here. And she leaves like this the next day, and she's happy. Is it perfectly aesthetic? No. Does she know? No. Maybe she will now if she watches this webinar, but for her, she's ecstatic, and it was a great solution for her situation. Okay. I'm mad at myself because I don't have a better resolution photo of this before picture, but I was adamant to use this case because this was my first venture into multiple unit temps printing. So this was the patient's initial presentation. We did the wax up. We already talked about that. And this is how she left, or this is how she left at the end of it all. This is MJ's work. These are not temporaries. Don't get excited. So this was MJ at the end of the project. Now, how did we get here? So what I did, this is her printed temps. She went with 10 printed temps. We actually left the molar alone because it's actually going to get extracted and get an implant. So, you know, forget that's not there, forget that's there. But these are the printed temps that we used with the Varcio resin that you can print with. So it looks like this. Just for reference here, this is the temps up against MJ's ceramics. The shapes are money in comparison. So this is her again, just replicating my design off Exocad. And then that was the final ceramics about a week later. Again, that's where she's at now. She's happy. We're now going to be doing the lowers. So I actually kind of want to show you guys how you do a shell temp because I think that's important. Keep in mind, this is the basic version of a shell temp. This is if you were maybe replicating off the tooth that's already there, you're not changing it much. Another thing you can do with shell temps is if you have a patient that's getting a bridge, you can make a shell temp of each abutment and put a tooth in the middle on Exocad, and then you'll have a bridge that you can cement in the day of the prep. So that's another way to use shell temps in that situation. Shell temps and temporaries are the same essential process through Exocad, except one, you are marking the margin on actual prep tooth. That's going to make your same day temporary. And the other one, you are marking a proposed margin of an unprepped tooth. So we're going to show you how we do a shell temporary, and it's actually pretty quick. And again, I slowed it down just so I can keep chatting like I always do. So this is a shell temporary case. So we're going to go in, we're going to click eggshell crown provisional. That is for shell temps. And then I'm going to just click one stone model only, just for, you know, vision purposes. We're not going to put the antagonist in for this. I just wanted to show you guys how you do this. So you're going to upload the scan. We're going to orient it again so that the occlusal side is facing upward. So it makes it a little bit easier. And you're going to click the tooth that you are making a crown for, and it's going to auto detect a margin. And generally speaking, it's going to keep it right at that gingival margin. Now, if you want to make 3/4 crowns, or if you want to make onlays, you're just going to raise those little yellow dots to adjust it. If you're going to be dropping the margin, you can do that too. You move to the next section. You can change the cusp. Maybe they had a little bit, you're adding to it or whatnot. So you can actually just freeform at that section. And then the crown is made. Actually, no, I missed a step. I apologize. I zipped through this step because I already have it set on my setting for shoulder width. But if you want to change the taper of the axial walls, if you want to change the shoulder width, you'll do that in this step. I have it already set and it'll remember the settings. So once you do that, you've got your crown, it's ready to print. So it looks like that. I encourage you, like I said before, print numerous copies just in case one breaks, just in case a patient you want to back up. It's not going to change the print time. I put this at the smoothest print possible, and I actually oriented it incorrectly. I put it on the intaglio surface, which now I put it more on the incisal edges. It's just more polishing off, but if you put it on the intaglio, you got to clean it out, and it's not so fun. So 20 minutes, whether you're going to print 1 or whether you're going to print 3. And this is what the printing platform looks like in the Rayware software. For reference, anything that fits on that silver box is going to print together. But remember, you got to use different resins, so you're going to maybe do different prints at different times. So if you're trying to print just 3 little temps and you've got casts, you're waiting. So it's only using 3 milliliters of resin, and I think when I calculated that down, it was like 85 cents. So it's actually cheaper than doing, you know, the full shell temps. So let's actually, I just want to show you guys this little dinky video I got off SprintRay, because I really didn't know anything about Formlabs. So maybe this is biased because I got it off SprintRay, but this is not a SprintRay lecture, and nor is it a 3D printing lecture for the most part. But this is kind of what they are proposing is how it goes. I have 2 of the Pros and I have 2 of the Moonrays, and I can attest to how slow that damn Moonray is. That's for sure. As far as 8 models in 26 minutes, that might be a magical orientation, but it's pretty close. I think mine's like about 32 minutes. And I think from what I know from my colleagues about Formlabs, this is pretty accurate. So, you know, it kind of depends. For me, it was a price point thing. I don't know if I would have got into 3D printing if my only option was a $7,000 printer at that time. Now, knowing what I know about all I'm doing, I would have bought it 3 times over from the start. But when, you know, I'm a small practice, we were, you know, when COVID happened, we had a lot of holes in our schedule. We have a lot of older population. So I wasn't like ready to dive and spend so much money. I actually kind of did this as a survival mode. I had a lot of time on my schedule. I couldn't really afford to wait 3 weeks for a patient to come back to start a case. So this kind of was a great way to fill my schedule fast. So if a patient came in on a Monday, you know, and wanted to do something and get a consultation and get going, we could see them back on a Tuesday, you know. So this was kind of a nice way to kind of rebuild the practice after the shutdown. And that's it. Thank you guys for watching. We're going to answer some questions. I'm sure there might be some. And again, if you can't think of it right now or you forget, you can message me on Instagram and we'll kind of go from there. And hopefully it was informative as much as it could be. I know it was a lot of information, but I'm here if you guys, have any follow-up questions on it or whatnot. I mean, I wish I had an hour lecture to watch before I got started, but it was a long and hard road, but I'm happy to be on the other end of it. So.
Yeah, thank you so much. That was awesome. I love the artwork on the videos. Really
I'm
phenomenal lecture. Thank you so much. Yeah, so we did have a few questions that came in. Someone early on was wondering, how long did it take you to feel comfortable with Exocad? When you really felt like you were becoming efficient.
That's a good question because I was really aggressive in my approach to figure it out. I had spent all this money on a scanner, and the only reason I bought a scanner was to do in-house designing and printing it. So it didn't take long. You're not going to learn everything at once. You can do the wax up about maybe 2 sessions in with a trainer and you're on your own. And that was a blessing for me because I would just make little appointments. Josh trained me and I would make little appointments with him. He would remote into my computer. I'd have my case ready and he would walk me through it. And after you do 1 or 2 of those cases, you're ready to roll on the 3rd. So I got a little bit stuck when I was trying to do cases for my ceramist, and I was basically saying, this is the wax up. I don't need a wax up from the lab. I'm going to do it. So when you're doing something at that level of accuracy, you can send the project to the ceramist. From my understanding, my ceramist doesn't really want to do wax ups either. So she was more than happy that I did the bulk of it and she was just tweaking it. So for me, the wax up part took about 2 or 3 sessions before I was comfortable to do it on my own. And then I would say it was about maybe 2-3 weeks after that where I started asking patients like, hey, this is what I'm doing. Like, do you want to see this, how we do it? And I thought patients were going to be like, oh, she doesn't know what she's doing. She's fiddling with the computer, but they love it. They really, really liked it.
Okay. And you had mentioned that your patient acceptance has gone up, I think, not only in the number of cases moving forward, but also in the number of units, right? So can you expand on that a little bit?
Right. So, I am humble enough to say I was really a newbie on digital designing. I didn't use, DSD or anything like that prior to this. I tried one software. It was really glitchy. It wasn't working. But for me, even myself, I wasn't venturous enough to tell a patient, oh, you need 10. I just felt like, I'm always trying to be really conservative. I was like, we could do this with just 1. But they're like, oh, well, 8 of mine look bad. And then actually they were kind of talking me and should we do more? And for me too, it was like, I don't really know what to tell the ceramist to design because I don't know what it's going to look like. And it seems like, should I tell them 10? And then how are they going to cut off the 2 if she decides to do 8? So it was a lot of confusion. Now I just plan for what I think is going to fill out the smile. And if they're not looking for that, then we go down. So that's kind of where it goes from there. Maybe it was me too that I didn't really have a good way to present it prior to having the chairside mock-up. So.
Okay, great. So how can you, or the question that came in is, how do you convert your diagnostic wax up to an eggshell provisional? And
Okay.
Not sure if you've done those before.
Yes, I have. And I was actually doing it a roundabout way. You can do that. You can do it, the way I was doing it is I was saving the wax up, diagnostic wax up, and then going into eggshell provisional and then marking the wax up cast. You could do it that way, which is kind of a roundabout way to do it. You also can just design directly in anatomic wax up configuration. And when you get to the end, it'll actually let you convert it to restoration. So, I talked to Dave about this before. The menu was very overwhelming for me and very intimidating to the point where I actually made like a cheat sheet on when do I use each category, because I was just like, this is not how when I think wax up, I don't think anatomic Pontic. Pontic to me as a dentist means the tooth is not there, not that the tooth is there and I'm putting a veneer over it. So that's, a good question. It can be done. There's a lot of ways to do it through Exocad, and I've probably done it all the dumb ways first. But you basically, the software knows if you use the right type of tooth or type of restoration, it'll actually know, and you'll start marking the margins, and then it'll flip it into the temporary or the shell temporaries, depending on which category you picked.
Great, thanks. Do you think designing surgical guides is easy on Exocad?
No. But to be fair, I'm not that, I'm not that there yet with it on the surgical guides. You kind of gonna have to crawl before you run with Exocad. So I know from everyone who's doing it is doing it quickly. I haven't had the chance yet to do it. So everyone who's doing it does it very fast. I've actually sent it to people to do it for me, and they send me their wax ups and I do it for them. So it's kind of like this trade-off I have now with colleagues, but and everyone keeps pushing me to do it because it is kind of a little bit of a no-brainer. You just kind of mark the same way you're going to mark a margin, you're going to mark around the cast, and you can exoplan, your implant that way. But no, I haven't played with it too much, so sticking to what I know.
All right.
No offense, Dick.
None taken, none taken. Let's see. So, do you mainly use Bago products for your temps?
So I did, because they were saying, oh, it's the smoothest resolution, blah, blah, blah. But what I didn't realize is it's a little tricky. When you put Varsio resin as your category in your software, it's going to move it to the smoothest print. When you put the Denko one in your software, it moves it to the medium print. So when I started using the Denka resin, that's a hell of a lot cheaper, and I moved it to the smoothest print. It actually polishes better. So I actually now use that. You get a big bottle for $500 versus the Varsio. The bottle is like this big. Now, I don't know too much about the longevity of it. They're claiming these Varsio resins are for definitive crowns. I haven't done that yet. I've done it for like implant provisionals. I've done it for patients who are going to be in the tent for a long time. They are very rigid, that's for sure, but I wouldn't call it a definitive crown in my practice.
Okay. Can you extend
yeah, I was gonna say maybe an indirect composite inlay or onlay. You could try it like that if you had a patient who was willing to see. I think that would be fine. I think it would work well for that. I've actually considered doing that for some cases, but as far as a definitive crown, I'm not so sure.
Okay. Thanks for expanding. Can you extend the eggshell or preformed eggshells into other teeth to help maintain vertical position on the temps? So I guess kind of like a Maryland bridge concept, maybe. Is that?
Are we opening the vertical? Is that what they're referencing?
I think maybe to maintain the position of the temporaries.
You can. I mean, you can. What I should have done, and it was just more so for simplicity's sake, is kind of had the antagonist scan in that video for you guys, so you can actually see what happens when you start to move the cusps up and down, because there's really cool anatomic morphing you can do in Exocad where it will preserve that occlusal contact that you want, or so there's no interference, but you can shape around it. I have done some cases where I've increased the vertical in Exocad, and basically what I did is I scanned the patient with a deprogrammer in or something. Maybe you're using, like a leaf gauge or something to open up the bite, and then I planned it from there. So you can do it. It's going to take some more training sessions. I'm not, nothing is, easy peasy. It's not, you're going to have to learn it. But once you learn it and you get it, you'll never go the other way, because it's too easy to pay somebody else to do it at that point. I can't. I like cringed when I had to send out my case to be planned and designed by by my lab this year when I hadn't had to do that in so long. I felt so defeated. I was so mad at myself. But, you know, sometimes you gotta just let it go, and it's water under the bridge now. So next time though, I'm gonna do it.
So you brought it up, the instant anatomic morphing, and I think you had the opportunity to try it before and after that version came out, right? So how cool is that feature?
I feel as if I'm like a little bit lucky because everybody else who has Exocad, I guess, hasn't updated yet to the new software, because I'm like talking about the features and they're like, I don't think we have that. But if you get with a good reseller and they're on top of it, they're going to keep you updated. My trainer, my reseller company, the second any update comes in, he's already remoted into my computer to provide it for me. So there is anatomic morphing. Before that, I was having issues, you know, when teeth were, you know, you're building up this crown, and then you got to go back and remove the cusp or all that lingual because it's too high. Now it actually will do it for you, and you can still preserve the shape all the way around. You can change that crown, and it's not going to interfere in that occlusal landmark that you have. So it's much easier. I think what I'm realizing is when I complain about something to Exocad, it gets fixed very quickly. So maybe that's what happened. Maybe someone heard about like my issues with my occlusal adjustment. So I did forget to say this only because it's not relevant in my practice, but if you have a milling unit, you can use Exocad and send it to your mill. So, and I don't have a mill yet, but sometimes I'm like, wow, I'm already marking all these margins. Maybe I should just be milling permanent crowns. But if you've got a milling unit, you're good to go. Especially you guys with scanners, you're there already. You just have, you know, maybe one crown prep away from getting a software, and then 2 crown preps away from getting a printer, and you're flying. So
That's a really good analogy there.
yeah.
And I think spot on, actually.
Are going to be like canceling their appointments left and right when they come back. That's how you have to relate things to dentists. You got to do it by how much does, you know, that's by unit. You know, we don't go by Bitcoin, we go by crown units. So
I think we have to change our price book now. This is genius. I don't know why we never thought about this.
The going rate is for crowns all over. Ours is $2,000 a tooth, but I don't know if my patients are going to pay that now anymore because they know what it's going towards.
We'll just ballpark. It sounds expensive, so yeah.
Yeah, here we go.
All right. So how do you choose? I know we've talked about this at length. So how do you choose between anatomic ponics, mock-up, you know, all of those work types that you showed on the database? And I've got a few rules of thumb too, but I want to hear what.
Yeah, you know, to be honest, you're going to probably be a little bit better at this because I learned off using anatomic pontic. And or that was kind of, you know, what happened to me is I actually started to learn things behind my trainer's back. So he was just teaching me diagnostic wax up. I went behind his back. I started trying to figure out how I was going to make like my temporaries and my shell temps. And he didn't know that. And I was doing it in such a roundabout way that I was wasting everybody's time. But usually speaking, and I'm going to be honest, the shell temps, you got to have an ideal, you need to have ideal landmarks on the teeth. You know, if you've got huge width discrepancies between the teeth, it's a little trickier to mark a shell temp for a veneer because you don't know really where your margin is going to land in between each veneer. For crowns, it's really easy, but because you're going all the way around. But with veneers, it's a little bit trickier. I got crazy and I would actually scan the prep right when I finished, like a rough prep, and I would go into the computer and I would merge my prep into anatomic wax up with my wax up, and it would give me actual definitive temps for veneers. And while I was cleaning up the patient and, you know, scanning for the actual definitive preps, it was printing in like an 18-minute shell temp. And people say, well, you know, I can make a Luxaflow, and you can. There's so many ways to do it. Just for me, it was cleaner. I'm not fidgeting with the Luxaflow. and if the patient's going to be in it for a long time, these are they hold a little bit better, and I'm not fixing all the voids. In Florida, our assistants they can do all the provisionals, everything like that, and I didn't really want to put this on her and doing all these, veneer temps. So we relax. We have movies on the ceiling. Patients watch the movie. It's printing, and then we just kind of cement it in. So I don't think I'm answering any question directly, by the way. I think everything has been like a roundabout way.
I think it's good, a good perspective though. Yeah, so I guess maybe to expand on that, there's two primary types, your ponic types, and then everything that is inlay, onlay, veneer, a crown. All of these you imagine have some sort of preparation. You could argue veneers, are prepless, but there's still like a definitive margin somewhere. The design is going to end there. So when you see the terms crown, coping, these those type of restorations, those are going to require margin. And if you're just printing, usually you may want to stay on the ponic side because you don't have to worry about placing a margin anywhere. You could just shape the teeth down to the part of the the gingival contour that you'd like to keep and maintain. So that's kind of the discriminator there. Does it have a margin, or is this patient's existing teeth and I'm designing over top of that?
Right. Maybe you should have trained me, Dave, 6 months ago.
Well, no, I think you do most of everything with a wax up, right? With the wax up type.
I just got so comfortable with it. I try, and I think it really depends on how you're trained. I can do it so quickly now and I'm sure if I did this repetitively with another one, but for me it works, and it's the workflow to do it in front of a patient is just a lot cleaner. So that gets me where I need to be with a patient's chair side. And again, I can't stress enough, once you get even a little bit quick at it, do it with the patients. You'll see they really like it. They may have seen a smile design mock-up where it's like a photo before and after and you tweaked with the photos, but it's something else when they see it with their actual teeth in the scan. So
great. So we have a hygienist who's asking about, or I guess is in the middle of transitioning into an in-house lab position, and they have
But better not be.
I'll keep the name undefined here. Just
yeah. Tell me later.
All right. So they have a scanner, mill, 3D printer. This is all completely brand new to her. He or her, I don't think okay. And where should I start? So that's a very loaded question. But you kind of just recently went through this. I think you utilized some training resources from your reseller.
Right.
There's plenty online.
There's videos online. It's, I learn better when it's my own case, because I actually really care about it. It's my own case, and I can present it with, the trainer, and he walks me through it because I'm telling him what I want to do with this case. And you'd be surprised, like, you'll do one case, then the next case, something different that you want to learn how to do, like maybe, virtual crown lengthening, and then you bring that to the table. And if you have a good company that is a training facility as well as a reseller, I mean, they're on it. They will remote into your computer. Mine has like complete access into my computer. I don't even do like anything where I have to remote him in. He's already got it in. He'll like text me, say, hey, I updated your software, or I added in virtual articulator for you. So the best way to start is to find a good reseller. That was my first, a little bit of a hiccup is, there's a lot of really good companies that know how to sell it, maybe that don't have the training workhorse to train you on it. And a lot changes with Exocad. So you need trainers who know all the updates and whatnot, because the updates are always for your benefit. But if you're sitting on a software version from like a year ago, you're missing out. So
Okay.
Trainer, that would be where to start.
Training is important. There are, if you go to Exocad or search Exocad on YouTube, you'll find our official page. We have a lot of basic tutorials there. So that would be a good place to just start generally, and then find the topics that are
Even like
interesting
an
to you.
Exocad Wikipedia page I've come across a few times where it's like a bunch of like badass technicians and ceramists. Actually, instead of having to watch the whole video, they kind of detail things in like bullet points. So, I figured out how to do quite a few things that way.
Yeah, and if you have Exocad, just click on the question mark. It takes you to that wiki. That's where we house our
Okay. You guys run
reference
that.
material.
Well, kudos. I like that. Thought it was a random person, but okay. Stand corrected.
It might be, but maybe
Oh,
within
yeah.
the company.
Maybe it's me. I don't know.
No, we've got very great technicians that
Trying to
update
leave
that.
my practice.
All right. Well, great compliments here. Great webinar. Best one I've watched. Awesome. Thank you. And let's see. ROI for bite guards is very good. Trying to expand on this. I don't know if it's really a question.
Return of investment.
Have you tried designing those? The bite splints?
Yep, and I've tried them in a few different avenues, and I mean, my thing is they're good. I kind of like the hard soft night guards for a lot of my patients. So the technology is not there on the printing end yet. It's there on the design end. It's not there on the printing resin end yet for that kind. But if I'm getting a patient that just, is a soft guard or hard guard, it's quick, it's good. It takes me about 20 minutes to print, and it's about like $4. So this is huge for if you are, patients that you're finishing off these definitive restorations, veneers or crowns. If you already have the wax up, I actually tested it. I made it based off my wax up to design a bite guard to insert it the day that I inserted crowns to see if it would fit off 10 crowns. And it did. I mean, if your ceramist is going off that design, you could have your night guard ready to go the day that you deliver your definitive restorations. If not, by the next day. I mean, there's nothing stopping you at that point, but I just wanted to see it just to see if it would work. So that's how I test if my ceramist followed my wax up or not. So
That's awesome. You've got a really great technician. I could tell.
She's awesome. She's excellent.
Okay. How long does it take to trim, polish the shells once they have been printed? And can they be relined?
So you don't have to trim them per se. You just have to snap off the support. So depending on how you printed it, depends on, how challenging that can be. But I asked SprintRay, they recommend you actually print it at an angle. It'll make it actually easier for you to snap off the supports, and it'll actually lower the print time. So that part is easy. There's no trimming because you've already kind of marked everything. And I have actually found, maybe I'm just very conservative in my preps, but they fit almost like a crown, like not like a shell, but almost they're pretty close to the fit, almost to the point where the cement, temporary cement fills in just that small amount. So I've actually been pleasantly surprised with shell temps for crowns. So
Yeah, and you could set your thickness. So if you think you're going light on the preparation, you can
absolutely
have a thinner shell.
Mm-hmm.
Okay. So if you do some crown lengthening, when would you do it? Is it easy to alter, reline a temp if needed?
Good question. So the crown lengthening is done virtually for me before it's ever done in the mouth. So anything that's coming off my printer already has my proposed new gingival margin. I do it the day of the prep. I go off the COI's principles. You're sounding to bone. You're using the KB1 chisel. And I actually have a laser that I remove the gingiva with. Generally speaking, I'm doing it the day of the prep. If it's just, routine aesthetic crown lengthening, I don't get too crazy. I'm not doing like 10 unit crown lengthenings. Maybe I'll do like a couple of teeth here or there, maybe raising it a couple millimeters. So with that said, your temporaries, essentially your eggshell temp, should mimic pretty close to your gingival margin, because you are doing that based off your new wax up, not off your original tooth. So if you are going to do that, you should go ahead and do it, on Exocad. Go ahead and remove the margin there so that your wax up actually will go all the way to the new margin. But if you didn't, you could probably just use Flowable. I've used Luxaflow up against the shell temp resins, whether it's for Dentka or for Varcio, and it's fine. A resin is a resin. It's going to bond to it. So the only cautionary tale I have is, remember, it is a resin. These casts, and the mistake we've made in the past, some of my colleagues, is when we did the injection composite technique, we wanted to go a step ahead of printing the cast. We actually wanted to print the splint or the stint you would use to inject through it to do it. But remember, it's resin. So if you're injecting through resin and curing through resin, it sticks to the stent. So we learned that very quickly. So you have to use PVS for that. But a resin is resin. All the materials right now are from the same composition that I have. So you can use flowable, or if you're more comfortable with packable, whichever. So to reline.
Okay. Next question is, would this work with Cerec scanners? Yes. Short answer is yes, and the longer answer is we have direct integration with the Connect inbox, so it could be an automatic import directly into Exocad with whatever you define on the Cerec scanner.
Gotcha. So that's like the same thing. You're going to put chairside milling instead of maybe iRecord, and it's going to go right into Exocad. So that was new for me. I didn't have mine set up like that until about 2 months ago. Dave helped me get that integrated. So that's actually kind of a really neat feature, because before that I was kind of going to the website, downloading the STL file, and then uploading it, which is an extra step, but
Yeah, and what I find is that most of the people, when trying to learn this workflow, that's usually the most challenging part, is just keeping track of the files that you need and what they're labeled.
Oh yeah.
So that integration is key to just get you into the software and designing. I think once you get to that point, then it becomes fun.
Yeah.
I think you would agree, right?
It's like it's a video game for adults, is what I tell my patients. So it is fun, and it's fun because I know that I've even reduced the cost for patients. They're not paying for this wax up anymore. It's done with. So we're moving forward. We're doing things digitally, and another thing is, specialists love this. I will send my specialist my proposed design, after somebody is going to do ortho or surgical design, with the implants where I want them, and they are like, really in awe of this. And in turn, they end up sending me these higher end cases, these big cosmetic cases, because they tell, the patient, look, I know you already had veneers done by someone you're not happy with, but, go to her. She'll show you how it's going to look. She'll show how it's going to look just off your teeth, so specialists have really been a huge referral source for me lately. My orthodontist does send us some really excellent patients because of this digital designing that we're doing.
How about another quick poll for you guys? We do have a few more minutes, and I think we even have a giveaway right at the end of the night. So yeah, we'll do that just before we take off. So the next question is, do you have in-house production and capability? And you can select all that apply. Difference between chairside milling and laboratory milling. Let's just say does it carry a puck? That would be your laboratory mills. If it mills out the smaller blocks, that would be chairside milling. Or you can select as many as you like. Do you have an in-house lab technician as part of your practice? All right, got a nice spread here. So 3D printers are in the lead, about 67%. chairside milling, 50%, dropping down a little bit. Laboratory milling is at 31. Okay, so someone must have been adjusting there. And in-house lab technicians, 28%. So very interesting data. I'll go ahead and close out. All right, maybe a couple more questions. Do you print deprogram? Do you ever
Yes.
utilize your traditional lab equipment?
Do I use my traditional lab equipment? As in?
Like anymore, do you ever have a case
Oh,
where
for
hey, I'm gonna do this
deprogrammers?
one
No.
analog?
Some cases I'm gonna take impressions in analog. Some of these multi-unit implant cases I might, but that technology is there already to scan it and for accuracy. Deprogrammers, they're getting printed, and it's really nice because the lab that was making my deprogrammers prior to me printing them was giving them like this like Holly retainer thing. My patients were like, get this out of my mouth. I'd rather have a bad bite than wear this. So the new ones that I print, you know, when you design them are really sleek. I mean, you can't even tell they're there. We're in the age of masks, so that they're like hidden almost. Nobody can really tell. And so that it's nice too. And the thing is, you know, I calculated, you know, I actually, and probably most won't, but I reduced the cost of things. I passed that savings on to my patients. When I didn't have to pay as much for a night guard, I pass that down to them, and they appreciate it. You know, it's, and you tell them, you know, we don't have to outsource this surgical guide anymore. We don't have to outsource this deprogrammer anymore. So it doesn't cost as much anymore. So they really appreciate that, because who would really think to even, you know, maybe do that for somebody? So it's all a hard time this year. A lot of our patients have been losing their jobs, and, you know, everyone's going through it. So it is a nice thing to do. You know, of course you can be more profitable if you calculate that margin, but, you know, if you're good and you're honest, the dentistry will come.
That's entirely entirely true. And just from a personal story, my wife has been thinking about doing some sort of cosmetic dentistry, and she stopped at that initial appointment because they really couldn't illustrate to her, this is what your smile is going to look like. And as motivated as she was to get started, she just didn't feel confident enough to move forward. She felt the options were, you know, are we doing ortho first? And there wasn't ever a definitive, you know, move forward. So I
Right.
think just from the content that you're looking at today, having that tool to really communicate, okay, this is like you're doing with the additional veneers that were initially options, right? So
Yeah. And a lot of the cases we get are pretty complex. We're redoing a lot of cases from past dentists. So patients are already very timid, and they kind of need to figure out, how are you going to be different than the past dentist that didn't give me what I want? So when you present it in a new way that seems like, you know, like this girl really knows what she's doing. I can even pick my tooth shape ahead of time. I can, you know, I can see where the, you know, they're on board. You are exuberating this, you know, knowledge that they weren't getting, you know, prior to that. And again, I can't speak on all the design softwares out there. I just know that majority of the labs I've worked with are using this software, and I didn't really want to go through a middleman. So I just kind of wanted to use what they were using, because I wanted to be able to have the same conversation with my ceramist if I'm not going to be utilizing them for my wax ups anymore. So.
okay. Let's see. I think we got. Hopefully, I didn't miss any. I'll take a closer look once we close the presentation, and we'll respond back to email if there's any open questions. I think someone was asking about sharing some practice files, and we could take that offline, and we have some within Exocad that we can share with you as well. Okay, let's if there's no more questions, yeah, I didn't see any more come through. So let me launch the last poll, and then we'll pull the raffle. So do you currently own Exocad software? Options are yes, no, I use other software for this application, no, I'm planning to purchase soon, and no, I'm just learning for now. All right. And thank you very much for that. All right, Diana, what do you say we pull a name here?
A name or no? I don't know the names.
No, okay, so here's what I did, just to be like totally fair about this. I pulled the registration list, and then I created this this randomized number series that gets recalculated every time I hit the sort. So you're going to tell me descending or ascending, and the top name is the winner. And this is completely randomized.
So what am I doing? I'm just saying descending or ascending. Or do I need
Just say small or large.
Small.
All right. So I'm sorry about the name, but I believe this is Dr. Sikand. First name Priyanka Sikand.
Oh, yay. She's going to love this.
I'm sorry if I butchered your name. All right, so we will get in touch with you regarding the next steps on that, and that is for the small creator software, some of what you saw here tonight. So yeah, thanks for participating, and Diana, I can't thank you enough. It's been just a pleasure over the last, what is it, couple months? I mean, this happened so quickly. And you know, I was really excited about this because when this was first introduced, maybe probably a year and a half ago or so, I saw the potential, and what I envisioned for the software was the application exactly how you're utilizing it in a chairside scenario, discussing with the patient, applications available through 3D printing that are practical and you know, just economically it makes sense. So this is just perfect. So I'm really glad we got a chance to connect, and that you were willing to share your journey and how you're benefiting from this. So
for sure. And if anybody has any questions, they know how to find me. But if they don't, you can find me as Beauty in the Teeth on Instagram. Or my email address is Diana Tadrus, DDS@gmail. But shoot me your questions. I know there's a lot of information, but I'm happy to help.
all right. Well, thanks everyone. We're 10 minutes over time now, but everyone have a great evening, and stay tuned. We'll keep your address on file, and I know we had been in discussions to extend this series into more of an educational tutorial. So we'll keep you posted on when we move forward with that project.
Awesome. I can't wait. That sounds like a big PowerPoint presentation I got to do all over again. There's a lot of video footage. It took me a long time.
You love it.
Thank you.
Yeah, thanks so much.
All right, take care, guys. Have a good night.
Take care. Bye-bye.